Hello, good afternoon, everyone. I think we'll just wait until 1 o'clock to start. Great. Thank you, everyone, for coming today, and welcome to today's webinar on the standard for infection control and what practitioners need to know. My name is Jennifer Neum, and I'm the policy analyst at the college. We'd just like to thank you all for taking your time to attend our presentation. Your interest and engagement are very much appreciated. We have enabled our Q&A feature, and if you have any questions throughout the webinar, please just type them into the box and we'll do our best to answer them at the end of the presentation. You can also email any questions you have to the college afterwards. There will also be a recording of this webinar posted on the college website for you to access later. We will be providing a certificate of attendance after this session, but would like to remind members that you can also record your professional development activities in the professional development log, which can be found on the college website for download. I'm very happy to be joined by special guests Rebecca Durcan, co-managing partner at Steinecke McCurry LeBlanc, and Amy Lee, professional practice advisor. Without further ado, we'd like to begin the presentation.
Hello, everybody. Welcome to our webinar today. So today we're going to be talking about infection prevention and control. As we all know, as members of the college and practitioners of acupuncture and Chinese medicine, it's an ongoing process that focuses on minimizing the risks of spreading infections to patients, to the staff, and to practitioners while performing required routines and procedures. And as practitioners, we have an obligation to remain current on infection and control procedures and to ensure that such practices are implemented in the practices by the practitioners as well as our staff. So it's really important that we know that we're expected to continually remain knowledgeable by referencing other resources, including our regulated provincial college. So today we're going to be using a safety program handbook as our reference, and we're going to be talking about infection prevention and control, our routine practices, which include conducting risk assessment, hand hygiene, use of personal protective equipment, safety handling and disposal of sharps, risk management of TCM practice, safe procedure and process, including acupuncture, and the safe procedures and processes of herbology. So when you have a brief moment, I would like for you to review the safety handbook, safety program handbook, just as a good reference, and also the college has provided several resources as well. So without further ado, I'd like to welcome Rebecca Durcan, just so we can talk about the safety program handbook on infection control standards.
Thank you, Amy. So I believe we move to the next screen. Here we go. So Amy, as you've indicated, the college has provided resources to the members of this college to assist them in complying with this incredibly important obligation. So you'll see on the left-hand side is the standard for infection control. And as you've indicated, this is available on college website. It sets out the expectations that the college has, and I'll pause there. We know there are a variety of different players on the stage. The college is one player, but these are the college's expectations that they provide to the members. And as you can see here, as part of that standard, there is a clear expectation that members of this college are responsible for maintaining a safe and clean work environment. There's also an expectation that members have to follow evidence-based procedures to minimize the risk of transmitting infectious agents. We'll talk about it a little later on, but in addition to this standard, you indicated the safety handbook. It's another great resource which really drills down into the sources, the concerns, and various resources that will help members comply with this standard.
So why don't I just hop off here? What is the meaning of infection control?
So essentially, infection control are steps their measures that healthcare professionals are expected to take to prevent infection or to prevent or inhibit the spread of infection within a healthcare setting. So to be clear, members of this college are not the only ones responsible for maintaining infection control. All regulated health professionals and some even non-regulated health workers are responsible for this. And it makes sense, right? There is an expectation that when a patient comes to see you, that there's confidence that they will not contract a contagious agent. They will not contract an infection within that workplace setting. So again, the safety handbook is a great sort of drill down. It really does explain this in a little more detail, but it explains how and why infectious agents can get transmitted, especially in a healthcare setting. When you engage in healthcare treatments such as acupuncture, puncturing of the skin, so others measures, that does result in a heightened risk for potential infectious agents being transmitted. So the standard alerts members to this, really provides some expectation for members to address infection control. And again, really provides resources of evidence-based procedures that members have to follow. So members can't simply unto themselves think up or create an imaginative way to deal with infectious control. It has to be grounded in evidence. It really needs to be a proven way to deal with infection control.
So you're not only protecting your patients, but also you're protecting yourself, you're protecting the public, as well as the environment of which you work in. So there's different areas that we need to consider when we're talking about infection control.
Exactly.
What are some of the principles to consider when keeping this knowledge up to date?
Well, we have the first principle that is set out in the standard, that members must keep their knowledge of infection control current. And that's a reflection that these measures change. They will change over time. So it's going to be important that members are mindful that what they might have learned 20, 30 years ago on infection control is likely not current as of today in 2023. So there is an expectation by the college that members take necessary steps to keep their knowledge of infection control current.
And there's the resource supplied by the college on the college website. That is where we can find it.
You got it.
Is there other places that we can have additional resources?
So I apologize if I sound like I'm repeating myself, but your safety program handbook, which is available on the college website, within its pages, there are a number of resources that members can rely upon. So there are resources from Toronto Public Health. There are resources from the provincial public health. There are resources from Canada Health. So there are different jurisdictions that provide different resources on different matters. There's also recognition that if you're an employer, you will also have additional obligations as an employer because you're going to have workers within your workplace. And there are resources from that organization as well. So I would highly recommend that all of your members go back to that safety handbook that was really important for them to become a member of the college and review that dedicated section on infection control, because you will see a lot of really helpful information, but more importantly, resources.
So when members are assessing the risks, we're going to jump into principle 2. What would be some of these risks?
So there are going to be a variety of risks, and it'll depend on the fact and situation. So I'll pause here. As you said, principle 2 that's set out in the standard is that members must assess the risks for contamination and transmission of infectious agents. So the college recognizes that members of this college are professionals. They do have the ability and obligation to assess those risks. So they're going to want to look within their 4 walls on where they provide treatment, what type of treatment. So if you provide acupuncture as opposed to a treatment that does not pierce the skin, the risks may be different. You're going to want to look at your own your own health situation. If you have a health situation that could pose a risk to others and yourself, that is a risk you're going to want to consider. You want to ensure looking at the time of year. The time of year might assess your risk assessment. We know that we're moving into flu season. We've just gone through a COVID epidemic, which obviously impacted. So those are risks that need to be assessed by members. And once that assessment occurs, then the corresponding action. What measures are you going to take in place to address that risk? Is it merely using gloves? Is it going to be using a mask? Is it going to be some other form of protection? Is it going to be looking at your immunization status? All of these different factors should be taken into account as a regulated health professional.
Is it appropriate to ask a patient their immunization status?
Great question. So legally, healthcare practitioner, if it's relevant to the treatment, you can legally ask a patient of their immunization status. You're not asking to be merely curious or prurient. You're asking so that you can ideally assess whether or not there's a heightened risk. And remember what I said earlier, if you're an employer, you want to ensure that your workplace, your employers remain safe. So it's okay to ask that. Some patients may decide that they do not want to, or some patients might decide that they have not been immunized in accordance with perhaps provincial recommendations. And that in and of itself is not necessarily a means to bar treatment, but it's going to affect that risk assessment. So there might be certain situations where you can't reassure or can't provide that treatment in a safe manner. Sometimes it won't be a factor. So the short answer, Amy, is you can ask. The answer might depend and vary on how you will provide treatment.
Right, and I like that this is a principle that we can apply because it's not coming from a place of judgment. It's actually coming from a place of how you want, as a practitioner, how high of a risk you would like to take if you're taking in somebody that has or has not been immunized. So this helps us as practitioners really understand the body and how much risk we want to put ourselves, our staff, as well as the members of our team, right? That's why the risk assessment is so important. So my next question would be, when we're talking about having proper PPE, the hand sanitization, this is another way to assess the risk. What hand sanitization is the number one thing that as practitioners we have to do before we walk into any type of initial consultation or any treatment. Is there anything else that we need to consider?
Are you taking on an individual basis? Is that what
on an individual basis, like gloves, gowns, masks?
Perfect. So the short answer is yes. And you've identified the number one, to be frank, foundational and basic expectation in infection control, hand washing. You know, we look back in history and there was a time when this was considered not to be relevant at all. And you know, there was a certain physician who said, nope, I'm seeing a correlation between women dying after surgery or childbirth and women not dying by simply having the physician wash their hands. So that's an example of things can change and the recognition. So hand washing is now considered a basic component. Getting back to the safety handbook, you'll see certain expectations that not just the college imposes, but some of the Ontario regulators impose mandatory hand washing. That's sort of a given. But as you've indicated, masks, it's become much more prevalent, much more normal to see masks within a healthcare work environment. So masks, having other forms of protective devices, whether that is gowns, gowning. We knew during COVID that this was really recommended. There were sometimes more proactive masks, not just the simple surgical mask, but more proactive mask. So we've seen these measures, again, not necessarily all are mandatory, but they are tools for members to utilize to ensure that they and their workers remain safe, and of course that their patients receive their care in a safe manner.
And also, you know, just a reminder too, when your patients are coming in, having a hand sanitizer, also having a pin-up on how to wash the hands, to make sure that that's in the washroom.
You got it.
Because often people may or may not have that information handy.
And getting back to what we said earlier, and you can see up on the screen here, there are a lot of resources to assist members. And by resources, I mean tips, I mean charts, I mean checklists, public health, the Ontario Public Health, municipal health authorities, and by that, you know, whether it's the City of Toronto or other various municipalities that have their own municipal public health, they on their websites will have tools, will have resources, will have certain ones of requirements. Thank you. We have 2 examples popped up right here. This is from Toronto Public Health. So these are 2 examples that you could print and put right beside your sink, or right in your clinic, just demonstrating how a cough should occur. These tools, these nudges, are great examples of assisting the members to not only comply with the college standard that we're talking about, but to really ensure that they themselves, their workers, and their patients are within a safe as possible environment.
So I'm really glad that we touched upon the hand washing and how to properly cough. What about equipment and supplies, the supplies that we use during our treatments?
Right. So they're, again, back to that sort of evolution and recognition that, simply running your hands underwater is not nearly as effective as using an antibacterial or using some form of soap to remove any bacteria, to remove possibly any virus. So there are tools, there are pieces of equipment that are now recommended to ensure that you are complying. So I would, again, recommend that you look within not just the standard, but that safety handbook, which really drills down on expectations and recommendations and things that you should and would want to have within your clinic to ensure safety.
I know that you touched upon this before, but could the risks change from one municipality to the next? Like, for instance, if somebody is practicing in Ottawa versus Toronto?
So I would say yes and no. So the basic sort of risk that infection control is necessary and infection can be transmitted, that's going to be that's everywhere. That risk is, but there is going to be a recognition that certain areas of the province may experience heightened risks that others do not. So there might be an outbreak of a certain infection. There might be an outbreak of a communicable disease that public health, Ontario Public Health, will become very involved in and become aware. So that might be within a certain area a risk that's present for members who live in another part of the province do not have. So it's really important that you are mindful of the existence of your public health, your local public health, that you keep alert and keep aware of any issues. But the short answer is, yeah, they can vary, but those basic foundational risks, they're everywhere.
Okay, great. Can we talk about record keeping?
Sure.
What's necessary for record keeping?
So I'd remind members from a legal perspective, record keeping is your friend. Record keeping is your way of providing evidence that you've complied with a standard. So the college does say that, when you've gone through this assessment of risks, whether individually as a patient or within your clinic, you'll want to keep a record. You're going to want to say, okay, I do provide acupuncture. I do provide perhaps cupping. What are the individual risks for cupping? These are the services that I provide. If you have a certain health condition yourself, that might be a risk you're going to factor into your risk assessment. Writing down these risks in and of itself provide evidence that you've gone through that necessary step. You have, in fact, assessed. So writing them down, again, provides evidence that you've performed this assessment. It's also going to be really important because it's going to help you then determine what are the proper steps, what are the proper treatments in the light of these risks, right? Will infection control, will hand washing be sufficient, or will I in fact need to recommend or require masks or something more invasive? That provides sort of the breadcrumbs for you to ensure compliance, but also to plan. And again, getting back to that brilliant safety program handbook, it does provide examples of strategies. So once you've performed that assessment, it will help you identify, okay, if these risks are present, these are some strategies, these are some tools and way in which to minimize and mitigate those risks. So we really recommend, again, you take a look. If you haven't looked at your safety program handbook in a while, please look it up on the website, review it again, because there's an enormous amount of resources that are going to assist you in ensuring your patients are safe.
Great. So what happens after the member assesses their clinic?
Okay, I think we have perhaps, there we go. As we said, once you've done that assessment, once you've realized, okay, there are certain risks, then you need to address those risks. Then you need to carry out certain procedures to address those risks. And again, this isn't just a make work project. By keeping a recorded list, not just of the risks, but of the procedures that you're going to carry out, it will demonstrate to the college, and most importantly, it'll keep your workers, yourself, and your patients safe. It'll keep a record of how to proceed. So you're going to want to implement these procedures. So simply assessing the risks, it's important, but that's not where the work ends. The work needs to continue, and you need to address those risks and set in place procedures to ensure that you're mindful and aware of the infection control risks within your clinic.
So even if you do have a record, even though you do have the safety handbook and you have staff and you're implementing all of these procedures with your staff, ultimately the safety of your patients does come down to the practitioner.
Most definitely. And again, that makes sense, right? If a patient comes to see you, a patient is seeking assistance from you, whether it's pain relief, whether it's a variety of other concerns, they are coming to you to seek assistance and help with their health. And so it only makes sense that they should expect and assume that they are not going to be put into risk, that their health is not going to be damaged by visiting you and getting treatment from you. So there is a very minimal expectation that your clinic, that your work environment will not pose a risk, that it will comply with all safety and infection control measures. So it's really, really important to consider and incorporate. This is a foundational expectation as a regulated health professional.
What are some of the things to consider when assessing the clinic for contamination and infection control?
So again, as we talked about earlier, and I don't know if I should be going to the next slide. Okay, so they're going to, whether or not they're going to be a variety of factors. We've touched on a couple of them already. So we know there's some foundational measures. You're going to want to ensure there's hand washing. The personal hygiene matters. That's sort of basic and foundational. But there are going to be other tools that you may wish to incorporate. And we talked about it earlier, the time of year might trigger the approach. So in the summer months, we're no longer sort of in a mandatory mask situation, although a lot of hospitals and healthcare practitioners are reintroducing masks. But even though it's no longer mandatory, you might determine we are moving into flu season. We are seeing increased numbers of COVID. I am going to recommend now that we do, in fact, use more proactive protective barriers, whether those be masks or gowns. So that is an example of certain risks that'll come in and certain responses that'll occur. Getting back also to foundational, the cleanliness of your clinic is an assumption, is an expectation. The patients will always expect and assume that it is a clean environment, and whether that's been disinfected properly, that the tools that you utilize will always be without any risk of contracting infection. So always using clean needles, obviously always having clean sheets or some sort of protective measure on the bed. These are foundational and expectation that patients will always assume and expect. And to be frank, the college will also assume that you are providing that minimum level of infection control.
And so I just want to touch on, like, let's say we had a patient and they called and say, well, I have an appointment today, this morning, but I woke up with a really, really bad headache and a stuffy nose and I have a slight cough. So this is an example of a risk assessment that you want to take as far as, do you want that patient to come in? How contagious are they? Do you want them to be wearing a mask? Do you want to be wearing a mask when they come in? Hand sanitization, upping your level of infection control, right? So like this is sort of like one of those things where, yes, we need to put this principle to practice and how we're going to assess the situation and how much risk we want to put ourselves, our family, our staff, and the rest of the people that work in the same environment, right?
That's a great practical example, because I'm sure that happens all the time as a healthcare professional, where you do get that call. And what you have just demonstrated is what the college expects and assumes of professional members. Namely, you've heard information that could deviate that risk assessment, that patients are going to be at a heightened risk of either transmitting, in this situation, an infection to perhaps you and your staff. So and again, if you have sort of steps, if you've sort of decision trees perhaps within your clinic, it might assist you saying, okay, do we perhaps recommend that the treatment be deferred? Do we recommend that they come in with a mask? Do we ensure that we all within the four walls of our clinic wear masks? So what you described is a perfect practical example of what is expected in today's day and age for regulated health professionals.
That's great. So the last point on the slide, safety using and disposing of sharps and other biohazard wastes. I see that in my office all the time, and we're expected to have the biohazard sign for fluids and blood and just general that type of waste, as well as our sharps box containing where we dispose of our needles. Why is that important? I know it's pretty obvious, but I just want to hear your opinion on it.
No, great. So from a legal perspective, what has occurred is that there's been a recognition that sharps in and of themselves and the disposal of sharps pose a risk. There's a heightened risk. So this is an example where provincial regulations, so not just the college coming in, there have been provincial regulations put in place to ensure that whenever a regulated health professional such as yourself uses acupuncture needles, or perhaps in other health professions that they use injection needles, syringes, they are disposed in a way that ensures that other people do not get harmed. So you might say, okay, I'm just responsible for my four walls, whatever occurs. I know I can get rid of these acupuncture needles safely. No one, my patient's not going to get harmed. I'm not going to harm. I can just throw these out in any sort of such way. But with the or syringes, other professionals might have syringes. I can get rid of these in a safe way. But the provincial regulation has come in and said, no, it just doesn't end with you, right? We're a community, we're a society. The people that pick up that bag of syringes, we don't want them to get perhaps punctured by that. There's a recognition that there is a life outside your clinic. So this is a situation where, because of the risk of the materials, that certain measures have been put in place to require sharp disposal containers, and that they do get disposed when they're at a certain level and not overflowing. And so you've seen those. So these are not just sort of arbitrary rules. The rationale, to be frank, for regulation in and of itself, not just professional regulation, but provincial regulation, is to ensure safety. And what's the minimum requirement to ensure safety? So having a sharps disposal retrieval box and ensuring that you dispose of it in accordance with the rules, that's an example of the government identifying this as a risk. What do we need to ensure safety? And the college, of course, encourages and expects that its members are going to comply not just with the standards of the college issues, but all provincial rules.
So I want to talk a little bit about some of the supplies that we use. We touched on the acupuncture needles, but the safe disinfection of cupping, our cups, or plastic cups, or glass cups, the rubber cups. How would you apply this to equipment and supplies?
So clearly, I'm just a lawyer, right? So I will be looking on situations as profession-specific tools. I would be looking to see what resources are there out there for me. If let's just say I became a new member, what resources are out there to determine what in fact is the safe method of ensuring that any cupping materials are completely disinfected, and if they are a reusable cup, that they can be used in such a way. So and you will probably, Amy, will be able to educate me better than anyone. There may have been a time where acupuncture needles might have been determined you can reuse. We're now in a situation, no, it's single use is now the standard. That's the expectation. So that's an example of a bit of an evolution. So on your question on the cupping materials, what may have been determined to be appropriate 20, 30 years ago might not be the case now. Are you able to sort of share what sort of resources you would look to ensure that you are up to standard on cleaning those materials?
Well, in the safety handbook provided by the college on page 22, it really stipulates a cleaning and disinfection and sterilization. So this will include the cleaning, sterilization, disinfection, which sterilants to use, how to decontaminate some of the materials that have been contaminated, and specifically some bloodborne materials. And on page 22, I believe that's where you'll be able to find how to properly clean some of your instruments, whether it may require an autoclave, where it may require heat resource, soap and water, complete disinfectant. So that's a really, really good place where I look to when it comes to equipment and supplies.
And again, just to give another shout out to your safety handbook that the college has created. This can be somewhat confusing. There are a lot of things to keep track of, right?
Absolutely.
And as a regulated health professional, you know, A, there's your treatment, and B, there's this business component, and there's a lot to keep track. So what I, as a lawyer, what I love to see is that the college has provided this resource to ensure that members are up to date, that there is a place where members can go and review and ensure compliance. So if you don't know right now, that in of itself is not problematic. But what's problematic is if you don't reach out and say, okay, what do I need to do? And your safety handbook has provided that resource that'll assist members in understanding their role.
And also, as a practitioner, there's really no such thing as over cleaning, right? So we have so many different surfaces that we work on. We have the surface of which the patient is lying on. We have the infrared lamp that we use, the needles that we use. There's also the electricity machines that we use, the cupping supplies. There's so many instruments that are involved with traditional Chinese medicine and acupuncture. So it's really important to make sure that we all know how to clean everything, and there's no such thing as under cleaning anything.
Perfectly said. I like that.
So I want to segue into workplace training. So many of our members are solo practitioners, which makes things a lot easier because we know in our brain what needs to be cleaned and what needs to be disinfected. But what do you think needs to be considered when working in a multidisciplinary office and or shared spaces with other team members?
So this is a really important legal issue that members need to be aware of. So as you've described, if you're a sole practitioner working alone, the people you need to communicate with, the people that need to keep up to date is you. So that it might be a little easier, probably a lot more work for you to do, but it's a little easier to keep up to date. If you work in a clinic, let's say it's an example where you're not the employer, you work as in a clinic. You got to remember that even if you're not the boss, even if you're just working in a clinic with other practitioners, you're responsible for your own professional standards, to complying with your own professional standards. You're responsible for ensuring that your patients that come in remain safe. So it's going to be really important that you ask questions. So you ask questions of your employer. What are the infection control? Are the infection control measures up to date? Where can I find resources within the four walls of my employer? Ask those questions. Because the flip side, and again, to members who are employers, there are independent obligations on employers to ensure that a workplace is safe. And this just doesn't apply to healthcare workplaces. All workplaces in Ontario have to have a certain level of safety, have to have a certain level of infection control. So again, if you're an employee in a multidisciplinary, I encourage you to ask, find out the resources, because you want to make sure that everyone's on the same page and you're not working in an environment that will result in you not complying with your college standards. And if you're an employer, be mindful that you do have requirements. You do have an obligation and responsibility to ensure certain minimum measures are put in place for infection control, that certain pieces of evidence are maintained, records are maintained. So the Occupational Health and Safety Act, that's a piece of legislation in Ontario. I encourage you to go to the Ministry of Labour website. Ministry of Labour website has an overview of the responsibilities that employers have. So it is important to be mindful when you are a member of the college, whether you're a sole practitioner, whether you're an employee or whether an employer, the standards remain the same, right? The standards remain the same for you. The college was going to expect the same on you, whatever your work environment, but your obligations might be a bit different depending on your workplace status.
Right, and I'd like to use that example, an example of like just having a check and balance in your brain as a practitioner, like upholding your membership with the College of Chinese Medicine of Ontario, right? So like, let's say you're employed as a acupuncture in a physiotherapist office. You have a bed that's provided for you, but in your own mind, you have to check the bed to make sure that it's safe, that all the joints are tightened and everything for your practice, for safe practice.
Exactly.
So we've been talking a lot about infection control, but also safety, right? Safety of
Yes.
the tools that you use, the equipment that you use, maintaining a safety log, right? Of all the things that you do once you get in a mental checklist, or it could be a physical checklist, to make sure that all of the tools that you are using as a practitioner of traditional Chinese medicine and acupuncture, that responsibility falls under you because you are providing that service.
Exactly. And this can sometimes be difficult, especially I find newer members sometimes struggle with this. But it's really important to remember that you are a regulated health professional. Your membership number attaches to you, not to your employer. So, and your responsibility to comply with your obligations as a regulated health professional, that rests with you. You can't simply say, oh, my employer told me not to worry about infection control,
Right.
or it was too bothersome. That's not permitted. Part of the privilege of being a regulated health professional is that you are granted a certain status in society. You are viewed as a professional. You are viewed as someone who can make important decisions on important matters. But the corresponding responsibility is that you can't simply offload it to someone else. That responsibility will always rest with you. So if you say, well, my employer didn't think infection control was important, you can't say that, because you know that the college has imposed upon you a minimum standard of infection control measures, and you must comply with those standards.
So speaking of check and balances, is there a sample cleaning log? Is there a log that people should abide by?
So your college has come up with a very simplistic, and you might look at this and say, what is this? Well, what this is basically a log demonstrating that the washroom within the clinic, the reception, the kitchenette, certain areas, it's a log of when they were cleaned and by whom. And this in and of itself, this simple cleaning log, and again, this is something that Excel or a Word document could create, this in and of itself will provide you or your employer, or let's say if the college ever came in, or let's say if the Ministry of Labor ever came in, doing an occupational health and safety check, it instantaneously provides evidence that on May 5th, these were the areas that were cleaned and by whom, and here is the time. So and these records would be maintained. I'm not saying for 30, 40 years, but getting into the practice of keeping these things, provides evidence that it occurred, but B, it's back to that nudge. It's going to be a reminder, oh, we have to complete the log every day. We have to clean the washroom. We have to make sure the reception is clean. We have to make sure the kitchenette is clean. So I would encourage that even this sort of simple document is an example of how a member could maintain compliance with the standard.
And every clinic is different, right? Like every clinic has different rooms. They have different ways of cleaning, right? So
exactly.
I guess it's difficult for the college to have something like that is standard for everybody. But I think as long as everything is included, the pertinent information is included, we can rely on that as evidence.
Exactly.
This would probably also include a maintenance log for all the equipment that we use. So not just for disinfection, but maintaining a functioning table, maintaining a functioning heat lamp, all of the things that we use as practitioners, that all of these things are checked maybe once a week, once every 2 weeks. Like you can dictate, but you can never double check too much, right? So
Amy, great examples. And again, these aren't make work projects. These aren't sort of additional obligations, because the college recognizes, and all regulators recognize, that being a regulated health professional, it's a lot of work. It's a hard job. There are a lot of things at play here. But by having a cleaning log, by having an equipment maintenance log, you are proactively, obviously, providing a safe environment for your patients, which is very important. But you're also, to be frank, informing yourself so that if perhaps you notice when you looked at the log at the end of the day that a certain area has not been cleaned, that's an immediate prompt that I need to go back and clean that. And if your equipment log indicates that there is a problem on one of the table legs, which indicates it's a bit weak, that instantly alerts you to proactively have that fixed. Because all of these proactive measures, obviously A, comply with the standard, but B, they will ideally avoid a complaint. They will avoid a CEO investigation. By putting these measures, the proactive measures, you're hopefully avoiding the college coming in and saying, okay, what's going on? Why did the table collapse when the patient went on?
Mhm.
Why
Right.
did the patient get an infection after contracted an infection after visiting your clinic?
Right.
These requirements, again, are not intended just for make work. They're intended to protect the public, but to assist the member in ensuring that they don't have to get involved in further regulatory matters on down the road.
And I also would like to use this as a means of communication with other staff members, right? So the
Great.
last time somebody cleaned room 1, room 2 was this time where the, when was the last time it was disinfected? When was it cleaned last? Like having a check and balance is really, really important for communicating to other people that yes, it's been done. Room 4 is ready to go, So I
Great point.
think having that document is very, very important. Mhm. So this concludes the principles part of our presentation. So I think I would like to move into some frequently asked questions. So I have
Okay.
a really, really good one here for you. Um, so this came from a member. I would like to begin offering home services. What do I need to consider regarding infection control?
So I would say everything that we've just discussed. So irrespective of where you provide, if you decide to provide treatment services in your own clinic or within a clinic in your home or in patients' homes, the same principles are going to apply. You need to ensure that you are providing treatment in a safe environment. So if you're being asked to go into other people's homes, it's going to vary that risk level a bit. You might walk in and ask to, assess, is this a safe environment? Is this a clean environment for me to provide those services? If they are not, you shouldn't provide those services. So if the person's home, in fact, doesn't provide certain reassurances, is it hygienic? Was there a sink nearby where I can wash my hands? All of those measures that you need to do before you provide treatment, you're going to have to go through that process. So in some situations, the environment might be fine. The environment you might determine based on your reviewing the safety handbook, you know what's needed to provide that treatment. So sometimes it might be fine. Sometimes you might unfortunately not be able, you shouldn't provide treatment if it's not a hygienic environment.
Right. So this is where we talked about the risk assessments, right?
Exactly.
You're assessing the risk of the home that you're going into, whether you provide your own linens, whether they have linens. Also, the clean needle technique really plays into this as well because you're making sure that any environment that you're practicing, your clean needle or aseptic technique is up to date as well. So
Exactly.
I
And
really
you can
like
see
that.
the variant. There's so much more discretion here, right? Because it's not within your four walls. So you have a lot more control
Mhm.
within your four walls. But if you attend and you arrive, and let's say the patient's partner is very, very ill and is right beside the patient and is perhaps coughing or in a state of health distress, that's again another risk that's now presented before you that wasn't present perhaps in your own 4 clinics. So you need to be mindful that there's a heightened level of risks there that you're going to need to assess and ensure that you can in fact provide treatment safely.
And I guess safety is the key, right? Like when we talk about the risk assessment, how safe is it for you to be there, and how safe is it for your patient?
Exactly.
Um, do we have a next question, Jennifer?
And this is, are we reading the questions or is Jennifer reading it? Oh, hello,
Yeah.
Jennifer. I speak and you
Hello.
appear.
Yes. So another common question that we do receive is if a patient that comes into your clinic is not comfortable with removing, a particular item of clothing, can a practitioner acupuncture through their clothing?
Uh, I no, absolutely not. Just because there's so many variables, right? Usually when I have a patient in and they're not wearing the appropriate clothing, either we'll provide draping or we do have a set of clothes for them to change into where all of the points are accessible. It's not permitted because the clothing is not considered a clean surface. This is not something that is that that is a clean surface because you don't know where the clothing has been. Even with the clean needle technique or any type of aseptic technique, the surface should be thoroughly cleaned and the needle is applied directly on the surface of the skin without contacting any surfaces. So that's just basic. It's a definite no. Also, the treatment equipment should always be disinfected and sterile prior to the procedure. So meaning that if you're using a heat lamp, if you're using the electricity machine, all of those little knobbies need to be disinfected with at least 70% alcohol. There's different types of aseptics and disinfectants that most practitioners can refer again to the safety handbook. And it's also suggested that if the patient is not comfortable with your clothing that you provided or draping, that they bring their own clothing, which they are comfortable. So during the consultation or even before, prior to the phone call, when we're trying to get the patient ready for their initial consultation or their first treatment, we do make sure that we manage our expectations. We manage the expectations of the patients, and to make sure that they, yes, understand that they need to wear loose fitting clothing, that all the points are easily accessible for safety, for disinfection, and to make sure that we can perform our job as safe as possible. Do you have anything to add, Rebecca?
No, I just, again, you're sort of demonstrating again the adherence to the principles. And that's what I heard as a non-practitioner from an infection control perspective. You went in and your assessment is that this is not a safe method of administering treatment. So that is why you cannot provide that treatment. And as much as the patient might insist and say, no, this is how I want it, you're a regulated health professional. So you're going to have to say, unfortunately, I cannot provide treatment in this situation because I would not be complying with my standards here if I did proceed with this treatment. So yeah.
And you know, like I've seen it in my office where some ladies have nylons on and they don't want to take the nylons off. But you know, I think it's something that you really need to be firm about, because you cannot have a safe practice. You can't have a safe procedure with going through, puncturing through even something that thin, right? Because you don't know, you can't control that, right? You're not in control of that environment.
Great, thank you. And on the next slide, we have another question. So what are some of the best practices that can be used to manage adverse reactions such as emergencies or infection control scenarios when it comes to treatment?
Is this for me, Jennifer, or is it for Amy?
For both of you, if you like.
So you know, obviously, as a non-practitioner, probably I'm not going to have the most practical advice. Amy's going to provide that. But from a legal perspective, I think it's really important that members are always alive and mindful that adverse reactions to treatments can occur, right? As health professionals, you need to be mindful and aware of that. And back to the lawyers love checklists, as we know, but you know, as a health professional, perhaps if there are common adverse reactions, having sort of a checklist and think this is what we should do in certain situations. It'll really help you, it'll help the patient, it'll help your team. So I can see this is sort of proactive and not once the adverse reaction occurs, but taking the time in advance and thinking, is there a checklist approach we can take on certain standard adverse reactions? And it might, again, depending on the risk level, I would assume there's going to be a spectrum. You know, some adverse reactions might require or necessitate maybe just simple first aid treatment. Some adverse reactions might require you calling 911 and getting an ambulance to come and attend. And as a professional, as a regulated health professional, the college will trust and expect that you're going to be able to have sort of a mindfulness and awareness of where along that spectrum your response should be. Amy?
For me, I think it goes back to consent. We've touched on this topic many times on consent. So making sure that the patient really understands what you're about to do, what the risk factors are, right? And what are the alternatives from your treatment to another treatment. So I really feel like it goes back, and I think it's important maybe to list out some of the adverse side effects, the adverse reactions, so the patient really knows what they're signing up for, right? And these are some of the things that are important, because let's say a patient is on a blood thinner, and with acupuncture, you are going under the dermis. There could be some bleeding. that is to be expected, right? So it is a risk assessment situation, and communicating the risks to your patient and allowing for them to decide at the end of the day whether they want to continue with your treatment or not.
Great, thank you. We received another question that it's quite common, and is the college able to recommend specific disinfectants that practitioners can use in their clinic?
Unfortunately, the college cannot recommend a specific brand of disinfectant. Um, Disinfectants are all registered in Canada and should come with a DIN number or a drug identification number. Health Canada has a drug product database website that can be used to search for specific products. So I feel like as long as your disinfectant brand is approved by Health Canada, you're good to go. This also, I keep saying, err the side of caution, right? You cannot over clean, you cannot over disinfect. I think as long as you have a safety procedure protocol that you are following and making sure that your product is registered, you really can't do too much. Yeah, Rebecca.
Perfect answer. Again, legally, don't you love having lawyers around? Everything gets down to legally. Legally, it wouldn't be proper for the college to say these are the exact brands that you should utilize. That's not really the role of the college. But getting back to trust, the college trusts its members to do its due diligence and ensure that they do use a disinfectant that does in fact does the job, that does in fact properly disinfect and achieves the purpose. So the college really tries to avoid getting micromanaging members. That's not the role of the college. The college sets out the parameters, sets out the expectations, and trusts members to do the job, to ensure that they're providing treatment in a safe manner. That's the role of the college. So it wouldn't be appropriate for the college to say you must use certain brands. They trust that the members are going to in fact do the work to ensure that it is a proper product.
Mm-hmm. And at the end of the day, it's the ingredients and the percentage, right? So you need to make sure that you have that, and that information is in the safety handbook for each type of equipment or material that we're using in our treatments. Mm-hmm.
Right, thank you. And our question 5, it was touched upon earlier, but if you could reiterate, where can members learn more about infection control and safety requirements if they're an employer?
Thanks, Jennifer. Yeah, this is it's a great question. It's an important question. So members who are employers need to be mindful that they have a separate set of legal responsibilities. So the college doesn't have a specific standard for employers, right? The college won't do that. But we know in Ontario that there is legislation from the province that does speak to employers. The Occupational Health and Safety Act, and that there are requirements within that piece of legislation that sets out requirements depending on the size of the clinic, the number of employees or workers. So again, I would really encourage you to look to the Safety Handbook. Safety Handbook has a great, again, identification of resources for employers. It also sets out the obligations for the WHMIS obligations, so certain posters, certain training that must be provided by employers to their employees depending on the threshold. So again, remember that the college is here to regulate the profession and ensure that the profession, the members of the profession, adhere to certain standards. But you have to remember that there are other stakeholders at play. If you decide to be an employer, which is an incredibly important job, there are going to be additional responsibilities. And part of that responsibility is ensuring you have a safe workplace. So you're going to want to look at the Occupational Health and Safety Act and take a look at the Safety Handbook, because they'll provide you with some great resources. And as I mentioned earlier, the Ministry of Labor, their website also has some great practical tips for employers to ensure compliance with a variety of pieces of provincial legislation.
Great, thank you so much. We have a few more minutes before our webinar is due to be finished, but we have a couple of questions that have come in. The first one is, what are the regulations in Ontario and or the City of Toronto for how to dispose of acupuncture needles after treatment, or what direction can you point the member in?
So I believe, and Amy, you can correct me if I'm wrong, I believe the Safety Handbook does provide these resources, but the City of Toronto, I believe on their Public Health Toronto, they do have steps. They do have a breakdown as to what providers can collect or where they can be disposed of if you want to themselves. So those resources are out there. I would also state, again, back to what we said earlier about keeping up to date. So if you checked 20 years ago and things, I would encourage members to always keep current. So simply saying, I knew where to hand them off 20 years ago, I'll keep doing it even if things have changed. You're going to want to keep up to date. So today it's September 2023, but you're going to want to keep up to date. Things aren't static. Standards change. Things evolve. Whether it's infection control measures or college standards. So I would encourage you to look at the Safety Handbook. Within Toronto, look at Public Health Toronto. There's a dedicated website, and it'll break that down for you and provide you with exact advice.
Yeah, that's a very good suggestion. To make it simpler, there are sharps collection agencies that will come and pick up your boxes. If you're an individual practitioner and you have one box, you can return it yourself to any pharmacy that collects sharps boxes.
Great, thank you. And another question that we received, where can members find the cleaning procedures of, for example, if they're doing cupping and it may include bloodletting, where can they find those procedures?
Page 22 on the Safety Handbook. There is a in-depth way of cleaning, disinfecting, and sterilizing your equipment.
Great. And I think that will conclude our session for today. Thank you so much, Amy and Rebecca, for sharing all your knowledge with us today. As a reminder to everyone watching, the webinar will count towards your professional development. And due to the limited time that we have, any questions that were not answered will be addressed at a later time, as well as there will be a recording of this webinar that will be available on the college website at a later date. And we will notify and update the membership once that's available. I hope everyone enjoyed the session today, and thank you again for everyone that was able to attend. I hope you all have a wonderful weekend.
Thank you. Thanks, Rebecca. Have a great
Bye.
weekend. Thank you, everyone.